I'm Dr. Peter Auster. Very nice to meet you all at whatever time of day it is that you're watching this. It's interesting. I'm doing a presentation here in a room that I normally don't use. And I found stuff in the room that I never knew existed. For example, there's a devil duck and a non-devil duck. I'm not exactly sure why they're there. But anyway, I'll show you a couple more things that I found around here in a few minutes, but that's not what you're here for. So let's show you what we're here for. First of all, somebody showed me this slide before, and it turns out that I look a whole lot better in black and white, don't you think? Here, I turn my head to the side. Yeah, I think I'm definitely better that way. So I'm going to see if I can have myself altered. So anyway, this is what today's webinar is not about. That's number one. So we've been hearing about new normals for the last 5 years, and I'm about done with normals. So that's not going to be part of this. We're also not going to be hearing about digital workflows, because that's not my thing. And I'm frankly kind of tired of digital workflows. This is also kind of a non-implant lecture today. There's going to be some in here, but not all that much. So we're going to move on from that. We're also not going to deal with this. Yeah, I'm kind of tired of them too. But what I'm not tired of is doing good things in dentistry without buzzwords. So here's what we're going to do. We're going to talk about the things in this world that are actually going right, because we hear about the negative all the time. We don't hear anything about the things that have gone good. And that's what this lecture is going to be mostly about. So what have we learned? Well, very simply, they came back. Now, we were thinking 2 years ago that what was going to happen to our patients? Would they be afraid to come to our offices? Well, most of us were out for about 2.5 months, 3 months, something like that. And we were scared, but they knew that we cared about them. They knew that we understood masking and gloves and all that other stuff that nobody else understood, maybe as much as we did. So they came back, and they're still coming back. And we had it right. Of course, we didn't have it that right, because this picture was taken the first day I came back after that 3-month period. And I had a hole in my shield, which probably wasn't a good idea. Not a great orchestration, but it actually did work. And we found out that most dentists and hygienists and assistants, very few people got COVID. Now, that may be not true now, because now with Omicron, it's spreading a little bit faster. But for the most part, we did better than everybody else out there, which is pretty amazing. All right, so what do we need? What have we found during this time when we're wearing the masks and the gloves and the shield and everything else that goes with it? This is what we found. We found that easier, safer, and faster, more efficient, and less expensive, and we'll talk about that in a minute, supplies and things and techniques made a lot more sense during that time. And we're still wearing masks, and we're still wearing stuff. So if we can move through our work a little bit faster, it's a good idea. So how do we get there? Well, I'm going to be telling you about some brand new products and some products that have been around for a while that are less expensive than what you're using and better. And I'm also going to be talking about products that you haven't seen before that have just made the market. Some of them are really awesome, and I'll show you why. We're going to be talking about a new generation of zirconias and a new generation of cements. And I'll tell you something. My feeling is that every cement that you used before the pandemic, you should throw out at this point. Pretty strong statement, but I'm going to tell you why in a few minutes, because there are some great new cements on the market that are much easier and better. Let's get there in a few minutes. We're also even going to talk about etching, because believe it or not, etching has changed. Who would have thought? But there are new etching products on the market like this purple one, and reasons to use them. We'll get there in just a few minutes. We're also going to talk about injection molding, but not the way you may have heard about it lately. There are some very expensive ways to do injection molding. I've got some simple ways to do it that are less expensive, that work beautifully for long periods of time. So stay tuned, that's part of it. So find some new things today. It's Thursday, use this stuff on Monday morning, if you can get them by Monday morning. So a little bit about me. Why do I have the right to talk here? Well, it's obvious because that is my picture over there, just a little tiny bit of my picture. So this company decided to use my photo, but they decided that this guy's photo they should use intact, and my photo should just be a little tiny skinny one over here with very focused fingers. It's good for my career as a finger model, but that's about it. This was the early part of my career, and I'm the small guy over here, and the second most miserable looking person in the photo. Obviously, this is the second most miserable. The most miserable was my instructor who had to deal with me. I understand. So what happened with me is I dealt with a very difficult stretch of time coming out of dental school. I hated dentistry for quite a while, and things needed to change it for me. And where it changed was at the Dawson Academy. And I went to virtually all the courses there at the time, became a Dawson scholar, really started to understand dentistry for the first time in my life, then got involved with the AACD, and that was a wonderful experience for me for the last 10 years. So now I get it, and I can create these cases and I can talk about them, and that's why I'm here. Next place I went is a place called Catapult Organization. The Catapult Organization, if you don't know about it, is actually a place where educators get to know companies, get to know products and supplies, so we can talk about products that we actually know about. I will not discuss a product that I don't love and I don't use in my practice all the time. So everything you're seeing are things that I use and care about. Otherwise, I will not talk about them in any of my lectures. And here's what I've learned from working with these companies. Maybe you should just read it. It's funny, I used to be a radio DJ. A radio DJ is you don't ever want dead air. But in lectures, you actually do want dead air because it gets people to concentrate about what's going on. So every so often, I'm going to keep my mouth shut, which will probably be good for you anyway. So let's talk about one-of-a-kind products that you may not have heard of before. So let's talk about this one first. This is called the iSpecial camera, and they come in a bunch of different styles. The iSpecial 4, I believe, is the newest one on the market. It's a completely unique product. There are very few products out there that only are made by one company. There's no other company that makes a camera that's strictly for dentistry. And it comes in really, really handy. And it also can be used completely by staff members. And that's great. Why is that? Because it's so simple. There's a grid in the photo lock. So what you do is you want the middle of the screen to be here. That's where the picture is taken. So if you want to take another picture of the same scene a couple of weeks later, you use that as the middle of the screen again. Very, very simple. I'm finally not taking all my photos, which is a beautiful thing. It's got all this modes to go with it. It's got standard modes, surgery modes, all these things that are really, really good to use. The face mode is very helpful. The mirror mode you just saw was, and you also has a telemacro for two teeth, which is really terrific. Here's your standard. There is the face mode that's very good for aligners. And this is one of the best things about it. You wipe it and you use it again. So simple, very different than DSLRs out there. Think about this as more or less a present for your staff because they love to take the photos, but they want them to be easy. All right, next one-of-a-kind product. I do not believe there's any other product on the market like this. This is something called Luxacrown. Now, Luxacrown, as you can see, looks like another product that you've seen out there. It looks like Luxatemp. Well, that's because it's made by the same company, a company called DMG, but Luxacrown is very different. It's a stronger and more lasting product. It's so strong that it actually beats in flexural strength a lot of blocks of other companies' products, like the CEREC blocks, like the Vita blocks. Pretty cool. And the purpose of this is to use it if you need a temporary for a really long period of time. It can be 2 years. It can be up to 5 years if you use permanent cement with it. It's a great opportunity, a great option for older patients and for cases that for some reason are being held up in treatment. Here's a case where I used it, where the patient, it was early on in the pandemic, The patient wanted to get her work started, so we started it, but she was living far away from New York. She was living in Vermont, which is kind of far from New York. So we sent her with the temporaries. Here's what they looked like 5 months later. Pretty decent. They look good. They held well. They were very strong. And someone who's a heavy duty clincher, that's what we want to see. More one-of-a-kind products. These are products you probably haven't used, and the chances are you haven't even heard of them. This product up here is called Viscalor. This is another product called the Occlusionator. They don't come together. I don't think they even know about each other, but they're a perfect combination, and I'm going to show you why. The Occlusionator, there is nothing like it on the market. Have you ever seen burrs like this? It's got these smooth burrs. There's nothing like that. Now, what do you want a smooth burr for? And what do you want a burnisher that works with it also? Well, very simply, it helps you glide across the tooth and make really perfect anatomy in your tooth. The longer, the way better that works, the longer the restoration is going to stay in place. And here's the way it works. It's got these little tips. You put them in the grooves of the tooth and you drop and drag it across the tooth. Very few people know about this product. I want you to tell the world about it because it's my favorite product over the past several years. I love this thing. This is the way it works in the tooth structure itself. In a minute, I'll show you how that tooth turned out. So this is the other product we're talking about. This is called Viscalor. Viscalor is made by a company called Voco, which is a very interesting company. I'm telling you about a lot of companies that don't have very large representation in the United States, which is pretty cool that you learn about this stuff because some of these products are great and there is nothing like this on the market. Now, you can heat composites out there, but when you're heating composites, you're heating composites that weren't meant to be heated. This is a composite that is meant to be heated. So what happens is you use it in this dispenser, you work on it, you turn it on for about 25 seconds. There's a dispenser that has a tip. Now, one of the great things about it is the tip. Look how long and thin this is compared to a typical compule tip. It's not even close. So you can get into the bottom of the box and really get great representation into the filling. So it goes in there very, very smooth. It goes in there as a flowable composite and it turns sculptable within a minute. It's pretty amazing. There are two different kinds, Viscalor Bulk and Viscalor. Viscalor can only be cured up to 2 millimeters. Viscalor Bulk up to 4 millimeters. And like many bulk composites, it's a little bit more translucent. So if you like the translucency, use the bulk. If you'd rather have something with a better color and better shade, and I'll show you a couple in a minute, then use the regular Viscalor, but it takes a little longer to do it because you're using just 2 millimeter increments of the material. So here's that case I showed you with the Viscalor and with the Occlusionator. Now take a look at this. If you look at the tooth next door, you can see how much secondary and tertiary anatomy are in this tooth. What the Occlusionator allows you to do, it allows you to create margins that are virtually invisible. You can't really see over here where the composite is, but it really creates the same kind of tertiary anatomy that you really probably couldn't have done on your own, unless you're one of those people in dental school who waxed up a tooth perfectly the first time. I was really jealous of those people, but that wasn't me. So it doesn't only work in a case where you need tertiary anatomy, it also works in a case where you don't need that kind of anatomy. So here's a typical premolar. There's the before, there's the after over there, and look how beautifully it meshes with the tooth. So this is a great product that is being worked on by another great product called the Occlusionator. You want to talk to me about it? I'd be happy to tell you the idiosyncrasies of this product. All right, so let's talk about some inflation busters. Now, inflation is bothering everybody outside the office, but certainly inside the office. So let's talk about some products that may be better than what you're using, but far less expensive. Now, I am willing to bet they're in your office, you're using this, because most offices use this as their disk system. Well, in my mind, there is a better system right here that's far less expensive. So what you're looking at here in the Super Snap system by Shofu, Shofu also made that great camera we saw before. You have a box that has the discs, it has strips, it has mandrels and a polisher. It's pretty amazing, all the stuff you come and you get together here, but that's not the major benefit. You see this? This drives me crazy. That metal circle in the middle of the hole. So if you're working on the front of tooth number 8 and you finally have it looking beautiful, and then you polish it and the metal scratches it, and that is a nightmare. Well, you're getting the same quality workmanship over here, but there's no chance of hitting any metal because there is no metal. Pretty cool. So the other thing about it is that in this world where COVID still exists, unfortunately, it's not a bad idea to use single-use cases. I know I'm talking to a lot of people in California, and ecologically that might not be the right answer, but infection control now it probably is for a period of time. Cool thing about this is you can get these 4 discs in one package, 4 discs over here, and it comes with that. You know what that is? That's a miracle. Well, it's not really a miracle. It's really a mandrel. But how often do you lose your mandrels in your office? I don't know where my mandrels go. I have no idea. I am certain if I look in the dryer, I'm going to find my mandrels attached to a bunch of socks that I have missing also. Whatever it is, you get a plastic mandrel in each kit. Very cool. And you don't have to worry about losing it because it's a one-use system. On top of it, One Gloss is the new system that Shofu uses for polishing. The combination together is rated in many publications as the top polishing system on the market, and about 25% less expensive than most of the other materials on the market. So think about that as a choice for you. You're probably going to save a good 30% combined over other products on the market when you buy the Super Snap and the One Gloss system. And here's that case I showed you before. And yes, it still looked pretty good 4 months later, and the polishing was done by One Gloss as well. So here are some of those products that I just mentioned together. I'm very, very honest in saying Shofu is one of our sponsors today, but these are products I use all the time. They're all good versus cross-contamination. You wipe this and use it. You use this once and it's gone, use this once and it's gone, and it's a very high-end product. All right, let's move on. What are you going to do? How many of you have 32 shade composites in your closet? I'm sure you do. We all do. And how many of those shades go bad before you ever use them? I know you do. It's a fortune that we've spent on these very huge amounts of composites that have colors like YO and CO and YE and CE. Do you use them? Maybe once in 3 years, but you throw them out and they're in a box that there are 75 in each that get thrown out. Unfortunately, that's the way. So what do you do in 2022? Well, what you do is this. There are a number of single shade composites out there. Most people know Omnichroma. It was the first one on the market. Admira Fusion, made by Voco, came out next. And then Clearfill Majesty, which is a very good product with the worst name in the history of the world. Now think about this. This was their first single shade composite. So for their single shade composite, they called it Clearfill Majesty ES2. I've got to talk to that naming person. Omnichroma has a much better name. Fusion Extra, not so great either. But anyway, they're terrific products, and I use them all the time for virtually every restoration in the back of the mouth and many restorations in the front of the mouth. So here's one case that I did way back. Here's the color of the tooth before the material is placed. Here it is when it's placed, a perfect blend. You can get a very, very good margin on it. Here is something else. This is what I call the post-hole miracle. Look at this. For how many years have we been trying to cover up a metal post with something that made the tooth look normal? Well, this is the way to do it. I've done this with Omnichroma and the blocker that goes with it. If you want to talk to me about it, this isn't a course where I really be going into this. I do courses about what I call the post-hole miracle. but you want to learn more about it, I'll be happy to talk to you about that. So next, another less expensive product that for me works better than the other products on the market. This is a company called Q Optics. It's a company out of Texas that make beautiful loupes, and they're really cool looking, but they also have two things that other companies don't have. Number one, they're a lot less expensive than the major name brands that I'm not going to name right now. And the customer service is so much better. I can't even tell you. So at one point, one of the major company loupes and these loupes, I had a little bit of a problem with. With the major company loupes, they told me the minimal amount of time I would lose my loupes, minimal, was 6 weeks. Can you lose your loupes for 6 weeks? I don't think you can do that in this world. With Q Optics, I had the pieces I need. They had fixed it within 3 days. You call them, you get a human being on the phone, and you get a lower price to boot. Anyway, take a look. If you're looking for an extra pair of loupes, it's always a good idea to have an extra pair. That's the company to go with. Give them a call. They're really nice people. And they're very comfortable loupes as well. And here's the other information about it. I wear them every day in my office. All right, now some interesting stuff just came out during the pandemic. I am certain, well, not certain, but I'm pretty sure you haven't heard of this curing light. All right, so here's where I get goofy. All right, is there anyone out there that can tell me what island this is? A TV show made this famous. Anybody know what beach that is? Well, unfortunately, during this call, let's see, I'm going to look at the Q&A screen. If anybody puts up a Q, I will check it and tell me what TV shows beach are you looking at. In the meantime, what we're looking at is a 3-second cure. Yeah, a 3-second cure. So there's a 3-second cure on this Ivoclar light, and there's also a 3-second cure on the Monet light over here. Both of them are excellent lights. Both of them I use every single day in my practice. All right, let me see. There's a Q&A. Let me click on it. And it says Gilligan's Island. And you are absolutely right, Gloria. Well done. So since you did that, I'm sorry to say I'm actually going to sing this for you. Wait a minute. Let's go back a minute. A 3-second cure. A 3-second cure. Sorry. All right. I'm sorry. I'll never do that again, I swear. Okay, so, oh, wait a minute. I just lost something, guys. I lost my screen. That wasn't what I was trying to do. It's going to reshare. Sorry about that. I'm trying to get rid of this screen. I know how to do it. Nope, that's not it. Sorry, guys. Let's see. Let's go back. All right, there's something in the middle of my screen that I can't get rid of. That's what the problem is. All right, well, anyway, I'm going to keep it in the middle of my screen. I think I can work without it. So anyway, this is the Monet Light. And the cool thing about the Monet Light, assuming you can see it right now, is that not only can it be a 3-second cure, but it is also a 1-second cure, which is pretty cool. So you can use it for 1 second for certain kinds of composites. We'll talk about that in a minute. Very little post-op sensitivity, minimal shrinkage. It is a really terrific light that I'm using every day now. I'm really enjoying using it. So this is the part that I can't see. Oh yeah, I can get rid of it. Awesome. Okay. So this is what the website for the Monet says. I just think that's a good ad maybe for pamperers, but I don't think it's a great ad for a curing light, right? But what it means is that the bottom of the box gets cured every time because of the power and the strength of the laser light. And it's higher than any other light system at the moment on the market for that reason. So let's go a little bit further. So here's what it will tell you. They'll tell you the curing time for many other composites. So omnichroma, 1 second for a 2 millimeter cure. 2 seconds for a 4 mm cure, which is pretty much all you're ever going to need. Here's what Harmonize is, Clearfield Majesty, all these other materials. And the cool thing about this is if you contact the company is AMD, they will tell you what the exact amount of curing time for your composite is that they've tested. Very, very cool, very interesting product. All right, so for my other curing light, I love the Ivoclar lights. I absolutely love them. They're weighted beautifully. They just feel good in my hands. And I've been using them for the last 5 years. Before that, I was always using Demi lights. But for some reason, the last generation of Demi light, I got a couple of them, and they kept on losing power after maybe 3 minutes. And I don't know what it is about them. Finally, I just gave up, and I love the Ivoclar light, and I also love the Monet. Now, the difference with the Ivoclar light and the Monet light is that you can only get the 3-second cure with their products, but they're really great products. So you can look into that, the Ivoclar Power Cure System. One more brand new light that you may not have heard of. This is called the Pink Wave. It's made by a new company called Apex Vista, which is a combination of the Apex company and the Vista company. And what it is a pink wave light. And they have found that a pink wave of light gives less volumetric shrinkage upon curing than the typical blue lights than we use. And here it is tested with some of the major products on the market. And you can see the change and the less shrinkage, which is really cool. It uses 4 wavelengths together, so you get a more thorough cure, less chance of staining, marginal decay because of it, and less post-on sensitivity. The other cool thing about it is the width of it. You see how wide it is? So the only thing that comes even close to it is the Velo Grand, which is another really good light, a light made by Ultradent. But the Pink Wave gives the extra powering capacity, and it also has the width to be able to potentially cure 2 teeth at the same time. Pretty cool. All right, another very interesting product. If you haven't used this before, what do you do with a situation like this? If you have root exposure over here, the patient doesn't want to go for surgery, or you don't want to put them through surgery. Surgery might have a problem on this implant next door. You want to do something to cover it. But if you cover it with white, you're going to end up with an oddly shaped, oddly sized tooth. Beautiful 2 Pink, made by Shofu, is a combination of shades that you can kind of mix yourself to create a gingival color. Now, this actually doesn't look very good here because it shows you, very different kinds of shades. But I found that it works very nicely. This is a case not done by me, but it worked very well. And you can see how well it meshes with other teeth around it. Very interesting thing to try and to use in your arsenal of materials. The other thing about it is that it's a geomer, and we'll talk a little more about geomers later. Most of the composites, or maybe all of the composites made by Shofu, are geomers. We'll talk a little bit about what that does, but basically it means that there's fluoride and other chemicals moving, or minerals rather, moving into the tooth constantly from the material to continually nourish the tooth. Pretty cool. All right, so now let's get into a battle. We have total etch on one side, self-etch in the middle, selective etch. Which is the winner in 2022? Let's find out. Well, we all learned first about total etch, and we were told by everybody that the only system that works, that etches the dentin and the enamel at the same time, and it works better than everything, was a total etch system. Okay, that's what we were told. But the same people that told us that then are now saying, you don't want to use total etch all the time, or very much of the time. Well, isn't that special, considering they told us to do that for about 10 years? Well, anyway, so basically the benefit to total etch, or the benefit to using an etch and wash system, that's what we call it. So you etch it and you wash it off after about 10, 15 seconds, is that you get the best etch of enamel. Why is that? It's because it's a very low pH. It's between 0.1 and 0.4, which is a very low pH. It's very highly acidic, which is why you don't want to get it on the patient's lips or tongue or anything like that. They claimed in the past that the other benefit is the smear layer is fully removed by the acid, so you're going to get a very strong dentin bond. Well, let's go to the next slide in a minute. In the meantime, for endodontically treated teeth and for veneer preparations, which hopefully are done all in enamel, you want total etch because you're dealing with only or mostly enamel. But the drawbacks we learned later about total etch, and that's you could get considerably bad post-op sensitivity, and you could get potentially bad bonds onto the dentin. Now, why is that? Well, basically because the phosphoric acid opens up the dental tubules, and that's it's supposed to do in order to get a good bond, but it comes into contact with the collagen, which gets exposed to the acid, the collagen, which is part of the dentin. The problem is if the collagen is potentially damaged, then you end up with a worse bond than you would have started in the first place. So what happens here is you want the tubules to be sealed and you want the collagen to be infiltrated to get a good dentin bond, but you don't want the collagen to be destroyed. And unfortunately, that can happen. One of the problems here is that there are two different types of adhesives in bonding agents. They can be acetone-based or they can be ethanol-based. Acetone-based adhesives require more moistness, so you don't want to dry them very much. You don't want to dry them as much as you would for ethanol. But how do you know how much to dry it? Do you dry it for 1 second? Do you dry it for 3? What do you do that's not going to cause the collapse of the collagen? The problem is you don't know, which is why total etch is not a great idea in 2022. So what do you do? Well, the next generation of people told us this: you should be using self-etch all the time because it's simple, it's easy, and it doesn't cause post-op sensitivity. So it's the answer to everything, right? No, not right. No. So the problem, or the good thing about it, is it's less technique sensitive. The monitors go through without opening the tubules. You don't have to get rid of the smear layer. There's less post-op sensitivity. All good, except for one problem, and that's this. The acid content is too low. So you're talking about a pH of 1.2 to above 3, as opposed to 0.1 to 0.4. What does that mean? It means the enamel is not fully etched. The fully etched enamel happens with phosphoric acid, not with the small acid content of a self-etch or of universal etch. So self-etch bonds are weaker. You get marginal staining. So if you get some brown stain or white stain on the top of the filling that you just did, it's probably because the bond wasn't strong enough. So what do you do? Well, in 2022, the answer pretty much is selective etch. Now, what is selective etch and what kind of etching do you use? Well, that's a change also. So the kind of etching you use is not the stuff that you used to use. You want an etchant that's a high viscosity etchant. Why? Because you don't want this stuff leaking onto the dentin. If it leaks onto the dentin, you're basically doing total etch and you're potentially causing sensitivity. So you want to use something that you know is not going to leak. So there are a couple of products on the market that work really well with selective etch, and they're both high viscosity. One of them is this interesting new product called Velvet Etch. Now, first of all, I happen to like the purple. The purple's kind of cool. And the benefit to this stuff is it's a 40% viscosity, which means it sticks very well. You put it in a spot, it stays there. Now, is that what I want to do in this tooth? Actually, it's not. And I'll tell you why. With sclerotic dentin like this, you probably want to go with something that's more of a total etch because it just doesn't bond as well. So in that case, you may want to consider going with a more total etch and actually etch the dentin. In general, you don't want to etch the dentin. Now, here's the other product I use. It's a great product made by Visco. It's a 37% pinpoint placement just where you want it, and it stays exactly like that, exactly where you want to put it. The other benefit to Visco HV, or high viscosity, is that it's got benzalkonium chloride. So you're dealing with an antimicrobial, and you're also dealing with something that's a great etchant. So you got two different benefits for this. Both of these are the two etchants that I use in 2022. Now, I will also, just going back for a second, I will also use, among my favorite etchants are also the UltraDent etch products. And I use them if I want total etch because they do leak all over. And that's what I want them to do. I want them to cover all the enamel. In this case, and all, everything that's exposed. This case, I don't want any leakage. So once again, bonding agents need water. So you don't want to blast the tooth or the collagen is going to collapse. The 10 MDP, we're not really going to go into that very much in this seminar, but 10 MDP reacts with the collagen that are full and not the collapsed ones. And that's how you get a good chemical bond. Got that? All right, so what kind of bonding agents do you use these days? Well, I use universal bonds, and there are certain ones that I like, and they're all different. I like them for different reasons, so I'll show you why. So this is All Bond Universal, which is really one of the best ones on the market. I can always count on Visco. Visco's a really great product company that's had many of the best bonding agents on the market for as long as I can remember. It's compatible with everything, with zirconia, lithium disilicate, dual cure, self-cure. It truly is a universal bond. Not all universal bonds are truly universal. Make sense? Good. Let's move on. That's one of my favorites because I just happen to like the product. It does have MDP as part of it. It has a high pH, which means it's compatible with dual cured materials. And a lot of the universal bonds are not compatible and they need an extra jar, an extra bottle of something else. That's the story. So you want something that's got some hydrophobic capacity and some hydrophilic capacity. But let's move on. Another terrific material that I used a lot during the pandemic, and I'm still using it. It's called Voco Futura Bond. I believe it's less expensive than all the others that I've mentioned. Cool thing about it is you've got two little compartments here. And of course, it's a one use. You press here and you move it into here. The adhesive is in here. So you're taking the two components that make it completely universal and compatible with everything out there. You're mixing it together and it becomes vital as soon as they're mixed. So you're not going to get a wasted bond where after a long period of time, it's going to lose efficacy because you're actually creating it by pressing that. That's why I particularly like this material. One more, and this is actually, to be honest with you, my favorite. And I use the Adhese Universal Vivapen because I love the feel of it. It's a little pen that's got a little tip over here. The tip allows you to place the agent only where you want to place it. Oh, I just realized that this slide has the information. I think that's German. I guess I didn't download the right photo. Well, anyway, it's what it's supposed to be. It's the one I use more often on the market. The other thing is if you use their curing light, their power cure, you can only cure it for 3 seconds, which is very, very cool. So know your bonding agent. Remember what I said before. You want to find out if it's ethanol or acetone based. You want to find out whether it's compatible with dual cure. You want to make sure it does a great job with other things other than composites. All of these do well with composites, but the question is whether they do well with dual cure materials and whether they do well with zirconia, and that's what you need to have. All right, let's move on. This is what you call the disclosure, and as I've told you, Shofu Dental Products, MicroDental, and Modern Dental Laboratories. I appreciate very much this opportunity today. And this tells you a little bit about the fact that no slides were basically changed for anything other than cropping or getting the exposure even. All right, now I'm going to move through this because this is important. I want to make sure you have enough time to do it all. Crown and bridge and cements, have they changed much during the pandemic? What's changed about them? Yeah, this is one of those moments where I don't say very much. But what I am going to do is, you can see my picture. I'm going to show you the first gift that anyone ever gave me as a dentist. All right, see, this is a picture. This is some guy pulling somebody's tooth, and there you go. And the guy flips over backwards. Okay, wasn't a very good gift. I wasn't going to put that in my reception room. That didn't look very cool. So anyway, we need easy cements now. I am done with complicated cements. I'm done with powder liquids. I'm done with using amalgamators or anything like that. And I'm certainly done with products that get so stuck to the tooth that you can't clean them off. And that was my problem with this before the pandemic. That's why I switched to all new cements that I am madly in love with. So let's talk about the materials and let's talk about the cements. Let's talk a little bit about zirconia. What is zirconia? You use it every day because 98% of dentists use it now. What is it? Well, it's basically a soft silver zircon. Now, what does that mean? Well, it's not a metal. People think it's a metal. It's not a metal. It's basically called a zirconium oxide. And if you want to really get fancy, it's yttria or yttria stabilized zirconia oxide. What the hell does that mean? I'll be happy to tell you. Well, basically, it means that when you heat it up to 1173 degrees, it's not going to be done in my office, but somebody's going to heat it to 1173 degrees, it turns into tetragonal crystals that look like this. When you heat it up to 2690 degrees, it turns into cubic crystals. Cubic zirconium oxide. What does that bring to mind? Well, we'll talk about that in a minute. Anyway, yttria or yttria, depending on who you talk to, is basically a substance that allows this material to stay where it was at the highest temperature. So if it was full of tetragonal crystals at 1173, once it's cooled down, it stays in the tetragonal crystal form. If it's gone up to 2690, it's going to stay in the cubic crystal form. Now, why the heck do you need to know that stuff? When I took dental materials in college and dental school, that was my question. I would fall asleep during this part. But you really need to know this, and you need to know it if you're writing a prescription, because you need to tell your lab person what you need. Do you want a Y3 or a Y5? All right, now I'll tell you what the Y3 or Y5 or 3Y or 5Y. That's another thing that gets flipped sometimes. All right, so 3Y is 100% tetragonal crystals. 5Y or Y5 is 50% cubic and 50% tetragonal. Now, why are they not 100% cubic? Well, that's because it makes it cubic zirconia, which pretty much will break as soon as you bite down on it. So you can't have a substance that's pure cubic zirconia in the mouth. So why do we need to know this? Well, the original zirconias that we were all using, the Bruxers of the world, are a 3Y. The newer zirconias, the Bruxer Aesthetics, and there are a whole bunch of other products that are equal to or better, in my mind, are 5Y or half and half. By making it 50% cubic, you're making it much more translucent, so it looks a lot more like a tooth. If you're going back to the 3Y, it's 100% opaque and 100% tetragonal, so you're going to get, quite frankly, an ugly tooth. But if you're doing it on a second molar, does it look better than gold? Probably. So let's take it even further. So there's a 3Y, a 4Y, and a 5Y. So the 3Y is the 100% tetragonal. You can see what the crystals look like here. The 4Y is a combination of the small and the large. So you're seeing a lot of tetragonal crystals here, but a smaller amount of the cubic crystals. So this one by nature will be less strong than this one, but it will be stronger than this one. The most attractive is the 5Y, the middle one is the 4Y, and the 3Y is the 100% very strong, very opaque material. So now we're going to make this even more complicated, because that's what I'm here for, to make your life interesting. So what do you got? We have the beautiful on this side. We have the strongest on this side. So of the major materials on the market now, we have the lithium disilicate, which has kind of taken the place where Empress used to be, because Empress is very hard to find these days. I don't even know if they're making Empress anymore. I can find out from my friends at MicroDental in a few minutes, or Modern Dental. But anyway, lithium disilicate, or Emax as we know it. But all of these at Ivoclar are now called Emax, because Emax became so popular that they call everything Emax. If you go to the bathroom stall in the Ivoclar building, it's called the Emax bathroom. Well, it's not really, but it sounds like a good idea, because lithium disilicate Emax is a wonderful product. Anyway, so we have a 5Y. We now have a 4Y 5Y. So you get a material that's a little bit more attractive on top of a material that's not that attractive. Or we have a 3Y 5Y, where we have the opaque, and then we have the non-opaque, but not quite as aesthetic as this one. Then if you go all the way over to this side, this is the most opaque product in zirconia. So this is the most opaque. This is the least opaque of anything. This is the least opaque zirconia. All right, so let's go step by step what we do with zirconia in 2022. First, you try in the crown. That's pretty simple. Then you're going to use one of the cleansing agents. The two that are the top on the market are Ivoclean and Zirclean. There are other ones we may talk about in a little bit, but do you have to use the cleansing agent? The answer is absolutely. We're finding that in order to get rid of the contamination from trying in the bridge or trying in the crown, you want to use the cleansing agent. So what are other prep cleaners on the market? There are brand new ones out there. There's something called Katana Cleaner, and there's another one called Fightback. What do they do, and what makes them any different? Well, I'll tell you a little bit about them. I think in a moment. The benefit to Fightback is basically that it has an antimicrobial agent in it inside the cavity cleaner, which is also good. The Katana Cleaner you can use to clean the tooth as well as cleaning the restoration. So do you want to use it for that? I use Concepsis to clean my restoration, which is an Ivoclar product. But if you want to use the same product to do both, the Katana Cleaner is a very good option. Then you want to sandblast. So you're going to clean the tooth off with the Ivoclean. You're going to sandblast it with a cojet sand. You want to use small particle size products. If you want to know about any of these products, you want any more information about them, either take pictures of the screen or I can send them to you if you want. So you're going to sandblast it. You're going to use an MDP primer before you use your cement, if it's not contained in the cement. If it is contained in the cement, then you don't need this stuff. So here are my favorite products on the market today. There are a bunch of good ones, but these are the ones I use the most often. You'll notice none of them were on the market before the pandemic. Should you price shop on these? Yes, you should, because they're all excellent products. They all are strong and they're all easy. So why do so many people, if there are so many products on the market, why do so many people use 3M composites and cements? We're going to answer that. Somebody give me answers in the Q&A. Now, one reason people use 3M products is that they're excellent products, but there are two other reasons. In the Q&A later, see if you can come up with some answers for me. Two others. So for strength and bioactivity, I like Theracem a lot. There's continuous movement of calcium and fluoride into the tooth from the cement. So the cement stays basically vital throughout the lifetime of the tooth, which is pretty cool. And you get a really strong bond to zirconia. It works well. You can take away the excess very easily. It's a product I like a lot. Now, if you want the easiest product on the market, there is no product that's easier than this one. This is ZRSEM, made by Premier, and I'm madly in love with this thing. The reason I'm madly in love with it is look what it looks like when it comes off the tooth. It comes off with one piece on the lingual, one piece on the labial. It's fabulous. It's strong. It holds well. I've never seen any post-op sensitivity. I've been using it for 2 years now. Does not use refrigeration. Great product, as are the other products on the market. Now, I would consider using the Theracem if it's someone who doesn't have the best home care in the world, because the bioactivity of it will actually help the lifetime of the product. The ZRSEM I use if I've got a good prep that's pretty retentive and I know it can be taken care of well. Now, what do you use for crowns that are less retentive? Well, I use this new product. This is brand new. It's called GSEM1, made by GC, which is also the best named product ever by GC, because it's not that G-annual thing that they put on all of their products. So thank you to them for naming a product well and for making a fabulous new cement. Now, it's a two-part cement, very high bond strength to enamel, dentin, and the restorations. Also comes with what they call the adhesive enhancing primer, which gives you the opportunity for much stronger restorations on teeth that are not that retentive. So if I've got a smaller preparation, what I use these days is GSEM1. So if you want to take a picture of this screen, this is pretty much what I've already said. I'm going to air a braid. I'm going to use the Ivoclar or Zirconia either before or after. It depends on what the instructions are from that particular company. I use Conceptus scrub to clean it, or you can use the Katana cleaner to do both. Theracem, GSEM1, or ZRSEM, 1 second tack cure in each corner, and then 20-second cures all around. And it's so simple now to cement zirconia. Now, what else do we have? Well, we have the next generation of RMGIs. I don't use the old RMGIs either. Why do you use RMGIs? Well, I use them in cases where there's not very good saliva control. So if you're dealing with the distal of a second molar and you just can't keep it clean, I'm going to use an RMGI. You're dealing with somebody that doesn't clean their teeth all that well, I'm going to consider the bioactive materials, but if I need a little more strength, I'm going to use the RMGIs. And these are 3 of the strongest RMGIs that have ever been on the market. So I am sick of Fujisem. I will never use regular Fujisem again, but Fujisem Evolve is easy to use. It's got a tack cure ability. It works well. You don't need an amalgamator. You know what I do with my amalgamators? I file them in a slot underneath my desk, if you know what I mean. Then, brand new cement made by Ivoclar. This is called Zircad cement. Works very well with all of the Ivoclar materials out there. Very, very simple cleanup. And it's kind of an RMGI, but it has the simplicity of cleaning as a self-adhesive. So give this one a try. It's also a really excellent product. So a couple more tips on cementing zirconia 2022. Number 1, never, ever, 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 did I say that enough? Etch zirconia. If you do, you're destroying the bond internally. You do want to use the air abrasion, absolutely, to give you a better bond. And you do want to use the Ivoclean or the Zirclean or the Katana cleaner. Use one of the 3 and you'll do very well. So this is I think pretty much the last part of our discussion today. We're going to talk a little bit about what to do if a patient can't afford full treatment. So I'm going to give you kind of a very short version of how I do injection molding. You can do injection molding, or if you want a temporary restoration to last for a long time, you can use Luxicrown, which is the first product I talked about today. So let's move on. Let's get this done. So what I do in these cases, I get wax ups. So say it's a patient who can only afford 8 crowns, but needs a full mouth of crowns. What I have the laboratory do is they wax up the teeth that are going to be crowns, and they wax up the other teeth that we're going to restore with injection molding. Now, why are we doing it with these? Well, we're doing it with these so a patient can get a case at least started, and then over the next couple of years, the injection molded teeth at that point can start becoming crowns when the patient can afford it. It can be done in the front of the mouth or it can be done in the back of the mouth. And I'm going to show you two cases. So we make a stent to go with it that we actually use to make the temporaries. Then we have a plastic stent that we use to do the injection molding. Here is an interesting case, a really bizarre case. So a patient came to me, she had some restorations done on the left side. These are very new zirconia crowns over here. She wasn't hitting on any of them. She was off them, believe it or not, by about 3 to 4 millimeters. It was crazy. So she was hitting on all the teeth on the left side and no teeth on the right side, which is mind-boggling. So what do you do in a case like that? Well, you don't want to make new crowns that are much higher than what you started with because you don't know what this bite is going to end up being. So the first thing I did is I sent the patient over to a TMJ specialist, oral surgeon. TMJ specialist said, don't do anything major here, but do something to give her biting on this side. So this is a perfect way to fill it in. So what we did here is we have wax ups on this side and we have natural teeth on this side in the model. Then we have a 3D printed model that we actually made our stent on. There's the plastic stent on it with the holes placed where we do the molding. Now, this is the way I did it at this point. I do it differently now. I will do 3 or 4 holes in a molar. I will do 2 holes at the cusps in premolars and 1 hole in a canine. But that's not what I did in the case that I'm showing you here today. So here's what it looked like before we started. There was decay over here we had to get rid of, and we had to somehow deal with the zirconia. So we use regular etchant on the zirconia. We use porcelain etchant on the 2 zirconia crowns. We then placed the plastic stent. Now, what material do we use? This is a decision that I have to make, that we make when we're working. There are some very expensive composites out there that are used for injection molding with a very different kind of system. I don't think you need it. To me, these are the best injectables that I've used. These are by Shofu. This is that genial thing again. Both excellent injectable composites. They're both really good. I freely admit that I do, but I do. But I do like the geomers because I like the idea that it leaks things into the tooth structure. So it actually, the fluoride groups and silicate, aluminum, strontium, everything goes in from the material into the tooth to help strengthen and hold the tooth together, which made a whole lot more sense in this case. This is what they call an ion-releasing injectable hybrid resin. The other one, and anyway, the Beautiful Flow Plus is a little thicker fillers, and the nano fillers are in the Flow Plus X, which are the ones that I'm using these days. As you can see with polishing, with the Super Snap we talked about before, really excellent system, much less expensive than a lot of the other products on the market. And if you don't know the Shofu system, F00 is basically a no flow, F03 is a low flow. And there's the buccal injectable by Genial, or whatever that's called. They have a silane coating, and again, you've got a different particle size depending on which type of material you're going to be using. So let's get back to our case. So we're injecting the product through the holes, do it through each of these holes. And this is what it looked like when it came out. And this is why I learned later that you want to add a hole over here, a hole over here, and a hole over here. So what I did is I took away these little bumps, put the stent back in, placed holes in that stent where we wanted the material to be. And that's what it looked like after it was done, after we were ejecting. So as you can see, it looks really good. Believe it or not, 3 years later, it looks almost identical. And the surgeon still doesn't want me to put crowns in it because the patient's bite is still somewhat unstable. But the patient's biting again, and it's worked out unbelievably. It's holding on to the zirconia. So if you create a good bite, it's going to work. And there's your before and there's your after in this case. All right, one more thing before we finish. This is anterior injection molding. What we wanted to do in this case over here is take these two teeth over here in the middle that were worn down. The 2 teeth next door were worn down. The patient only wanted to pay for 2 veneers or 2 crowns. So what do? We do injection molding on the others. There's your color. Here is the wax up. The red marks are areas we need to work on in the back. We need to do equilibration. So these don't get worn down like the other ones were. They were worn down because of the problems in the back of the mouth. So I made a stent. I cut out the front portion of this side of the stent and the front portion of this side. Left this on to make temporaries after we prepped them. So we etched them. We bonded them. There's the adhes. Here I am placing the flowable composite. That's what it looked like after the flowable's placed. And this is what it looked like after the crowns came back. Pretty cool. The crowns match very, very well with these very, very, very translucent filling materials. Not bad. So let's go over what we did today. I'm maybe 2 minutes late. So restorative dentistry has gotten easier and better. And yes, more economical if you buy the right stuff. So try something new and enjoy the fact that we really are in a golden age of composite dentistry. Further learning on composites and all this stuff, catapulteducation.com, the AACD, which I love, the affiliates of the AACD. We have one in New York. Talk to me about it. And this wonderful organization called the American Society of Dental Aesthetics that I hope to be at in October of this year. And a big thank you to MicroDental, to Modern Dental Laboratories, to Shofu for their help, to my buddy Laura Kelly. I hope she caught at least a minute of this. And my new friends, Gabrielle, Tin, and Maxwell. And if you want to contact me about any of this stuff, you can contact me at drpauster@gmail.com. I'm going to check that Q&A. Why are 3M materials the most popular dental materials in the United States?
So the first 2 entries that we had, one came from Dr. Ken. His answer to this was marketing. How did you respond to that?
Well, that's part of it. Yeah, I mean, you've got a company that also sells Scotch tape and Post-its. Here you go. I got some right here. So their marketing budget is higher. So yes, that's one of the answers. But there's one more that's equally as important.
Another one coming from Dr. Michelle, and she says that it was taught in dental school.
You got some smart people on this call, because that's actually true. Because 3M has contracts with many, many, many dental schools. And once people use products, they get very used to using the products. And it's very hard to try something new if you feel comfortable and you've been using them for the last 2 years or 3 years after you get out. So that's exactly right.
Awesome. But those were the entries that we had for your question pertaining to that slide. Okay. Would you like to go over the questions that we have regarding the entire webinar?
Sure thing.
Awesome. Starting with Dr. Jenny. She says, hello. How do you floss the areas treated with injection molding?
How do you floss the areas?
Yes.
I'm not sure what you're getting at there. I'll tell you what I do with floss, which is very interesting. So people wonder, how do you keep the cement out of the interproximal? Well, basically what I do is I take some Glide floss and I add some KY jelly to it or any other kind of silicone. So what I'm doing is I'm creating a silicone treated layer in between the 2 teeth. So as the composite goes in, it doesn't lock in. Then it's very, very simple to get it out. You can use any of the products that can go between teeth, whether it's just a disc or a strip, or a brain drain as to the Denmat product, but anything you can use to go between teeth.
Awesome. And Jen, if you had a follow-up question, if you're still here, awesome, actually, here we go. Jenny asked another question. Can the teeth covered with injectables be flossed?
Can the teeth covered with injectables be flossed? Absolutely, yeah. Yeah, because once you've done that, you haven't really changed the contact.
Okay, awesome. Another question that we had coming from Anonymous. If you are using a stent, STENT, To place the flowable composite, how do you prevent the interproximal contacts to be bonded to the adjacent teeth since you did not use any bands?
Well, that's exactly what I just said. There are two ways to do it. One way is to just basically do what I said and use the floss with silicone attached to it. But the second way of doing it is by doing every other tooth at a time. So instead of doing all of them at the same time, do number 20, 28, 30, and then do number 29 and 31. That's another way of going about it.
So another question that we had coming in, do you use single shade composites for class 4s?
I do not. I do not. I was in the beginning of Omnichroma, and I love the product, and I've lectured about it for a long, long time, written about it. But I find with class 4s, you really want at least one opaque material and at least one translucent material, so you can get different shades inside the tooth. And it's very, very difficult to do that with a single shade composite.
Okay. Another question that we had coming in as well too. What happens to the color of single shade composites if the teeth are whitened?
Nothing. Nothing. I don't know this about other products, but I do know with Omnichroma that if the tooth is whitened, the Omnichroma just keeps pulling in the new color of the tooth, so you don't have to change anything.
Okay. And last question that we see so far, if you have any other questions, please feel free to drop them in the chat. We still have a little bit we still have the presence of Dr. Auster, luckily. Is there a downside to using a laser curing light?
The only downside that I've found to using a laser curing light is that it's a laser, which means you have to put a sign up in the room like you do with other lasers to keep people out. You have to wear eye protection. And using eye protection can be a little bit complex when you've got loops on and you have a shield on and all that other stuff. But it comes with a little, hard to explain, it's a little plastic sunglass that actually goes inside your loops. So they have come up with a response to it that works. It's just a little bit more complicated, but it is a very cool light to use.
Okay. So far, that seems like all of our questions that we had. We had another question coming in from Dr. Jenny. Can genial, Jaenil, be used for the stent technique?
Genial injectable can, yes. I mean, there are a lot of different. Genial has become the GC standard name for a lot of products, the Genial Sculpt and a couple of others. But yes, the Genial injectables can be used, and it's a very good product.
Awesome. Cool. And thank you again, Jenny, for asking so many questions and participating. We really appreciate that. But that seems to wrap up our question and answer segment. Again, thank you guys for attending today's webinar. We really appreciate your participation and your attendance. Dr. Auster, this was fantastic. Thank you again.